I believe that medical illustrations can aid diagnosis for NTDs, and the research aims to establish evidence for this. Specific objectives are to complete the best medical illustrations as possible and design specifically for those that will be using them. To create the medical illustrations, they are based on research and reference, working with experts, as well as gaining first-hand experience by visiting patients in endemic areas. From there, a feedback process will occur by testing a response to the illustrations, testing first among clinicians, next among the health workers in Ghana, eventually culminating in revised and improved illustrations. Beyond that, the objective is to provide the medical illustrations that have performed the best during the testing process and distribute, as previously mentioned, in the form of a pamphlet to primary care level, especially in local community settings, to encourage early case reporting. Thank you very much.